Um, Not that I can specifically define the differences to. In my
Mm-hmm.
mind, I have an idea of what I categorize as a disease versus a disorder.
Mm-hmm.
Yeah. Jen, can you hear us?
I can. How's the audio sound?
Much better.
Yeah.
Good. Is it loud enough?
It is, and we can adjust the
Uh,
loudness on our computer too, so if it's too quiet for somebody.
Oh, okay, great. All right. So, is to share the presentation, what do I need to do? Just open it or?
Yes, go ahead and open it, and then I'm going to share the screen with you. So you'll see a pop-up that says, "Are you ready to share your screen?" And if you just
Okay.
click yes, then we can see whatever's on your screen. So I'll turn this over to you.
All right.
And so any second you should see a pop-up.
I do. It says show your screen. So I just click on the red box that says show your screen.
Yep.
All right.
And then sometimes it takes a few seconds for it to pop up.
You guys see that now?
Not yet, no.
Okay. So during the presentation, will it be just the screen, or will there be like a little box with me in the corner, or how will that work? I am trying to remember previous webinars that I've attended.
Yes, it will be. So we will see your screen or your PowerPoint, whatever you see on your screen, we will see. And then we'll keep your video, and it goes, people can change where the location is, what corner of their screen they want it in, and they
Huh?
can make it bigger and smaller on their end. If for some reason you don't want people to see your face at some point during the presentation, you can X off your video, so you can close the video and we'll still hear your voice, but we won't see you. Some people do that. We feel that it's nicer to have people on screen. It feels more real. Since being
Right.
on the computer itself is kind of distanced, it's nice to see the presenter. Um, so if you're comfortable sharing your screen, it's nice to just keep it up the whole time.
Yeah, that's fine. That's fine. So can you guys see? Can you see the PowerPoint now?
no.
Not yet, no.
Okay. Let's see. Does it usually take this long?
Mm-hmm.
No.
Okay. Let me see. Sharing. Oh, there, you guys are back. All right. Because for a while there, I could only see the screen, my PowerPoint. I couldn't see you all. All right.
So there might be an icon near your microphone and the video camera that allows you to show your screen.
Okay. Well, I don't have that red box anymore. I clicked on it, but that
Okay.
didn't work. So, suggestions about how to get the PowerPoint?
Yeah, I'm going to turn it back to me and then we'll try again here.
Okay.
I'm going to show my screen. And do you see my screen?
I do.
Okay. All right. So I'm going to turn it back over to you.
Okay.
And you should see that pop up. And does it say show my? Yep, now I see it.
Yep. Me too.
Now I see part of my screen, and then I see like both of your webcams like on top of my screen.
Mm-hmm.
So
We will close off. So when you begin your presentation, we won't be there. So it will only be your video and your presentation below. You can minimize it so that your video is really small.
okay. So I
If
just
you,
drag it.
yeah.
Let's see here. Oh, I see. Enlarge. Whoops, that's going the wrong way. Shrink. Okay.
And if
And
you
what?
go into the full PowerPoint mode, so if you do the show my slides, I think your video camera might disappear. And I don't know if you plan to do that or not during yours.
No, I'm happy to leave my little webcam thing up. So, let's see here.
Yeah, so when we turn this over to you, Jen, neither Elizabeth or I will have our webcam on.
Right. So can I minimize during the presentation the little box that has all the controls?
You can.
If I do, then what would I click on to get the controls back?
If you drag it to the corner so that you can just barely see it, nobody else can see your toolbar. So I know it's probably right in the middle of your screen, but we can't see that. All we can see is your PowerPoint.
Okay.
Yeah, but if you drag it into the corner far enough that you could drag it back if you needed it for something, that's fine. Yeah.
Okay. And that made my, okay, there we go. If I click on webcam, that makes me appear, and then if it looks like if I click on the screen, that makes me disappear. Okay. I see. All right. Oh, I see. Okay. Got it. Okay, so now I'm trying to, whoops. Unfortunately, every time I click on my screen, it makes me disappear, and I'm not necessarily meant to do that. Hang on a second.
So it makes you disappear to you. Now you just disappeared to us.
Oh, okay, okay, good. I didn't, okay, so I don't have to look at myself, but I'll still be there.
Correct.
Yes.
Yeah, even if you can't see you, we can see you.
Okay, let me see here. Now, I've got the PowerPoint in slide mode. Oh, I know what's going on. Okay. No? It doesn't seem like my keyboard is advancing the slides. Let's see. Okay. Are there any tricks that you're aware of with the PowerPoint once it is in this mode?
If you click on your PowerPoint once with your mouse, and now you click the arrows, does it work?
Yes. Okay. Got it.
You just have to click into it once.
Got it. Okay. And so and when I did that, I didn't disappear.
Right.
Okay. Oh my gosh. Sometimes I just have to laugh at myself at not being very tech savvy. So, all right. Okay. Anything else that we need to practice and
yes.
Yeah, I have a want me to start, Ed? I can just kind of run through the plan.
Yeah, sure. Okay.
Yeah, so when we sign on the 15th, if you can sign on 15 to 20 minutes before it starts, just to do a quick practice, make sure everything's working and set up.
Great, yeah.
Troubleshoot the last minute things. If you want more time than that, let us know. We can sign on earlier. But we'll plan to sign on. People can sign into the webinar and they'll get a screen that says it will begin at 7 p.m. Mountain Time. And then Ed will come on right at 7 o'clock and give an introduction to the foundation and introduce you. And then at that time, we'll have you turn on your webcam, or I can turn it on from this end too and prompt you to turn it on.
Is it 7 Mountain or 7 Central?
It's 5 o'clock Mountain Time, 7 o'clock Eastern Time.
7 o'clock Eastern Time, yeah.
Wrong direction. Yes.
Okay. Just want to make sure.
Yeah.
Okay.
So 6 o'clock our time. So Ed, if you sign on at 5:30, and Jen, if you sign on around 4:30, 4:45, that'd be great. And then Ed will give the introduction. You turn on your camera, and we'll have you begin. I'll turn the screen over to you. So usually during our introduction, Ed or I will run a PowerPoint slide presentation, and then we'll turn the presentation mode over to you, and you can start up your PowerPoint slides. and go from there. Do you have spots during your presentation where you have a pause for questions, or are you saving that for the end? What's your preference?
You know, my preference is usually when I'm doing presentations to have people ask questions as they come up.
Okay.
Is there a way that you can field questions to me as they come up? I'm happy to do that.
Yes, we can do that. Probably once you're kind of nearing the end of that slide or that topic, not to interrupt you right during the middle of something, we can sign on. We probably won't turn our cameras on, but we'll turn our voices on. And we can ask you the questions. We can read them to you. If for some reason you want to read the question or it's not making sense, in your toolbar, if you pull that up and go to a box called questions.
Okay. Oh, got it.
That's where you'll see the questions come in. We're happy to read those to you so you don't have to worry about going back and forth during your presentation. We can just ask you. And
that would be perfect, yeah.
We'll plan to do that. We'll kind of do it here and there as the questions come up, and then at the end, typically, we get a wave of questions too. So if you want to spend 5 minutes at the end of your presentation fielding questions, we'll help you with that as well. There's another option if you want to use this. There's two things. One, you can pass out handouts. Everybody's going to ask if you're going to share your slides. You do not have to do that. We will let people know if you want to. If you want to share a handout before the presentation, we can connect that onto this GoToWebinar panel that participants get so they can download it before the presentation starts. Or if you had papers or anything you want to pass out to people, we can connect that to the GoToWebinar panel. The other thing is if you wanted to ask poll questions. So if you wanted to do a pop quiz during your presentation or get to know the audience, if you give us a list of questions before the webinar, we can program those in, and then you just tell us when to launch them. So for example, some presenters have asked patient or participants, who are you? Are you an SLP, a patient, a caregiver? If you're interested in that, or how many of you have performed this type of treatment? You can ask yes, no questions or multiple choice questions for that if you're interested. You don't have to. It's kind of nice for engagement.
Yeah, I think I would like to know like who's on the call as far as clinicians versus patients, just to kind of get a sense. Because yeah, I mean it's definitely geared towards both, but just nice to know.
Excellent. And probably 90% will be clinicians and students.
Oh.
Yeah, just to give you that heads up that most of them are clinicians that have registered so far.
Okay. And okay, that's great to know about the handout because I did have some links. I've contacted a couple of the companies that provide education for this, and they both have links to help patients find providers of this therapy.
Okay. Great.
So because I get that call all the time. People call my office saying, I live in Kansas. Where can I find somebody who does this? So I have some links that I would love to share with people. So perfect.
That'd be great. Yeah, just send those to us at least a day before. We'll get them loaded onto there.
Okay. Sounds good.
Excellent. Trying to think of anything else that you should know. Can we record this webinar?
Absolutely, yeah. Mm-hmm.
Okay, and we won't share it with anybody until you've had a chance to review it, make sure it's okay with you.
Okay.
And then if it's okay with you, we'll post it on our website so that people can view it at a later date.
Yeah, that would be great.
Okay, excellent. Thank you.
Do you have a short bio that you can send us? So when I kick this off, I usually spend about 5 minutes on the foundation and some housekeeping items about how people ask questions, and then a minute or two introducing you. Mm-hmm. So if you can send a short bio, I'll put that slide up while I'm introducing you.
Okay, I can
then I think I have one of your written short bios, but if you want something different than that.
I think that what I sent you is fine, but it's a little on the long side, so if you wanted to cut that down, I mean, feel free. You don't have to read the whole thing, so I'm fine with whatever.
Sounds good. I'll send that to you, Ed.
Okay. And then a lot of this is about audience engagement. And so you said you like questions as they come in. And that's fine. But another way to do this is to have maybe 3 or 4 breaks in your presentation where you actually have a question mark slide.
Okay, yeah, I can definitely do that because the presentation's broken into some different sections, and so at the end of each section, I could just have, like you said, a question mark. That would work well to kind of prompt people to any questions before we move on. So that sounds good.
Okay.
All right.
And then, Jan, are you a licensed myofascial release therapist?
Yeah, there is no license or certification for myofascial release. I mean, I definitely provide it, and I've been trained, but there's not like a certification for it.
Oh, I didn't realize that. I thought there was a place on the West Coast where this started, or where I thought this started, that actually there was a licensing or certification.
I wonder if that's by state, because I've never heard of that, but I wonder if you said that was in California?
Well, it's on the West Coast. It may have been Oregon or Washington. I didn't remember which. And I thought I would share briefly. I've had myofascial release therapy, and it has been miraculous. So in 15 minutes, it has washed years of pain from me.
That's great.
Do you have stories like that to share with?
I do. It's kind of one of those things that I find it to be very successful, and patients love it. But at the same time, I'm also trying to be careful to not like oversell it. But it is. It's fantastic. So I do, and I do have several quotes from patients who have just found it to be just a big game changer. So yes, I'm going to share that with, at the same time, trying not to promise the moon for everybody. So yeah.
Well, I don't know if Elizabeth shared this with you or not, but the response has been tremendous.
That's great.
We have 188 registrants at the moment.
Wow.
And usually about 40% show up. So we'll do another email blast, and I would say we'll have 250 to 300 registrants in total. And so we'll probably end up with close to 80 to 100 participants. So
good.
This is really, I don't know, the timing is right, or enough people like me have told people how this has helped me, and the word is getting around. So
yeah, this is definitely a hot topic in the swallowing therapy field for sure.
And is it just head and neck cancer patients that are benefiting, or are others benefiting as well?
Others benefit. The other population that I find that benefits as much as the head and neck cancer folks are patients who have had some sort of thyroid surgery. I've just started the past year working with an endocrine surgeon, and she told me that after the patients would have surgery on the anterior neck, that they would have a lot of, their number one complaint was difficulty swallowing. And so I've been seeing a lot of those patients as well. Same thing. I mean, some of them it's one session and their swallowing is just significantly better.
That's amazing.
Mm-hmm.
So it helps with swallowing, it helps with pain. What else does it help with?
I think most of the people that I work with feel like it just makes swallowing so much easier, that it's not as much effort, it's not as much of a struggle to swallow.
Well, the therapist that helped me will be on, is a participant, will be on our webinar. So you're going to be talking to a range of people, from patients that have no idea to experts.
Right. I kind of anticipated that. Yes.
Okay.
And actually, I have like one of my first slides is kind of acknowledging that, so that people kind of understand there's all sorts of levels of expertise on this call. So there's going to be lots of different levels of material presented. But asking about the benefits of the myofascial release is there have been a couple of research studies that have come out, and one of them that I'll be talking about a lot on the call was done, it was a small sample size, it was only 5 patients, but it was during radiation, and all of the patients felt like it really helped with managing pain and discomfort during radiation. So, I mean, that's a use that I haven't even had an opportunity to treat patients with that yet. So it's...
Yeah, at MD Anderson, they are doing more prophylactic measures during early treatment, and they're seeing positive results from that.
Yeah, absolutely. Absolutely. I don't know any clinicians that are using this that haven't seen positive results.
Jen, do you have any other questions for us?
I don't think so. I think that, getting together maybe a half hour before the presentation sounds like a good idea. And I will definitely send you the handout. If I send it to you the day before, does that work, Elizabeth?
Yep, that'd be great. Perfect. Yeah, and if you have any poll questions that you want us to ask, I can set up the one for what type of person are you.
Perfect.
Yeah, I think we can have up to 5 handouts, and I think we can have up to 10 poll questions.
Okay.
Also, if you want to communicate with us privately during the live webinar, if you expand your question box, question area on the control panel, you can send either or both of us a message. And you can send it privately, or you can hit send to all. So, one of the things that I do about 10 minutes into the webinar, into your presentation, is I remind people that questions can be asked at any time. So, but it's also a way for us to communicate. If there's something you need us to do.
Okay. Sounds good.
Well, Jen, thank you so much for doing this.
Yeah.
Oh, my
have
pleasure.
questions up until then.
I just love this treatment and feel so passionate about it that I'm just happy to share information, especially knowing that patients might be also on the webinar and be able to get some information about it.
That's awesome. Thank you.
Yeah, we really appreciate this. We think that this is, anyway, thank you for volunteering to do this and share this and help spread the word.
Thank you for the opportunity. I'll look forward to talking to you in a couple of weeks.
Okay. Good. If that's it, then we'll see you on, I think it's the 15th, or yeah, on the 15th.
2 weeks from tonight. All right.
Excellent.
Thank you.
Thanks,
Okay.
Jen. Bye.
Bye, Jen.
Bye.
Cool.
Jen is gone, but her screen is still active.
Yeah, I wonder how long that stays up. Yeah.
Anyway, so I don't know, I just found it interesting that on Wikipedia and a few other places, there was not a line in the sand about disorder versus disease.
Interesting. I wonder if the World Health Organization differentiates between the two at all. I'd have to do some research to find out. In my mind, a disease is something that's contracted. Something, I guess, I mean, you can get a disorder as well.
Yeah, I mean, they did mention bacterial, viral, as an indication of what people may call it. But they also, the web said, in many instances, it's just used interchangeably.
Yeah. Yeah. I suppose people call dementia a disease more than a disorder, but if I think about it, it's more of a disorder in my mind. My own personal definition of disorder. Because you contract dementia, it's something that happens over time. It's not. I don't know. Yeah.
That's interesting. I always thought of dementia as a disease of the neurologic system.
And yeah,
So.
Yeah, I could argue either side on that.
As many people did on the forums that I read.
I believe it, yeah. Well, I would love to throw that into the SLP forum. They're brutal on there. It's so mean.
So, anything that we want to talk about as far as the 2018 conferences before we all get on, or the device?
Yes. Let me start with the device because I have some updates for you on that. I picked up the device from Betsy and I had a chance to go through her feedback form together because she wanted to kind of explain some things to me and walk through what she meant by what she wrote. I will scan in her feedback form, but it might be beneficial to have a short call to discuss some of the feedback that she wrote, just because I was able to talk with her about what she meant. It might be easier than me trying to type out what she meant. Have a conversation about that. She provided some really useful feedback. She tested it with her sister, who's a nurse, and then with her significant other who has no idea about the medical field. He's a car mechanic, I think. And so some good input there. She had some good clinical input as well. And I think she kind of approached it from this generalist perspective where she doesn't, she is, I would consider her an expert in swallowing disorders, but she was approaching it as if she's just a generalist speech therapist and not somebody who's expert in swallowing disorders, because I think that totally biases how cool this is if that's like all you work with. Like, this is great. If that's just 10% of what you do during your day, it's okay. She thought, and in her mind I think she was thinking the device was around $100 to $200. She thought for that price it looks too simple. She also thinks that for that price you would need to have a log collected, so some data that gets collected somewhere, even if it just stays on inside the app itself. She thought it would be nice to have a graphic, so kind of like on your iPhone, your Fitbit, that shows how you've progressed or how much you've walked each day, something like that. She thought that for exercise number 2, where it has the timer that goes like this, that was distracting from trying to keep the meter in the green, because her eyes kept going down to the timer.
Oh, that's interesting.
Yeah, she suggested moving the timer up to the top. She also didn't like, I love the circle that goes around. She said that's not necessary and distracting, and again, it's taking your eyes away from the meter. She thought that something better would be a numerical countdown, so have like 5, 4, 3, 2, 1.
Okay, that is interesting, because I also love the circle that goes around.
Yeah. Another thing that I thought was important that she said was the meter is jumpy, so it's not just a smooth up and down every time. She said that's distracting. Yeah.
Yeah, there are probably ways to smooth that out. But,
yeah.
And it also depends on what you saw, like if the connectivity dropped for a second or two, the meter like fell to 0 and then back to 25, or if it was just like jittery around a certain point.
Yeah, and I can record a video as well to show you. I think I know what she means because I've seen it do it on mine. It's still connected, but it's just choppy when the meter moves. And maybe it's a connection thing with the Bluetooth, but also I'm not sure if the device is moving on what increment. You know, if it's moving up every 2 kilopascals, it's set to move, or if it's every 100th kilopascal. I don't know what the sensitivity is for that.
So the sensitivity, I believe, is whatever the measurement is every 1 second.
1 second. Okay.
It moves. We might want to add a tolerance that says if it's within 2 kPa, don't move it.
Okay. Yeah, I'm not.
But I mean, that's all very good feedback.
Yeah, I thought it was helpful. We talked a little bit about pricing. She wasn't sure what price she would pay because we kind of debated it. She said for $50, that's a cell phone bill for a month. It's kind of high, but maybe she'd do it. For $30, she would do it because that's pretty cheap. It's a meal out somewhere. She would pay that for this device. I'm trying to think. She couldn't put a number on how many people she thinks could use this. And the reason for that, she said, was that people who come to her, she gets these referrals, And she asks them, what's your concern? And they say, like, my shoulder. And then they do a swallow study, and they're aspirating, but they don't really care because it's their shoulder that hurts. And so there's limited buy-in unless you have those patients that are saying, it's hard to swallow, things get stuck, that are really concerned. And I think that's a small number, especially in the outpatient world that she works in, where people go to their general doctor and complain like, oh, I coughed once when I drank my 7-Up. And so they send them for a swallow study thinking this is major, and they're not that concerned. It was one time that happened, and so they have no buy-in. But I think for the head and neck cancer population at the VA, there could be a big buy-in if you had a clinician that was invested in that or anything.
Okay.
Yeah. That was not what she said. That was one of my thoughts there towards the end.
Did you feel it was the testing was a good experience for her?
Yeah, she did. Her recommendation was to test it with general speech therapists in like the nursing home environment to see if they think that's something they would use clinically with their patients. And she offered some names of people if we wanted to pursue that at some point. I don't think that's critical. But she says if it were going to be something that was on the market, she says the app needs to work 100% flawless. She had a lot of connectivity issues with the Bluetooth, where she said one time she had to go back and forth 7 times just to get it connected.
I don't know if you saw my email from today, but it reiterated that issue with about it has to work.
Yeah, I think that's super important, especially if you're charging anything more than $10. It has to work.
Yep.
And I think that's going to take some money to invest in nice equipment and make sure that the app looks good.
Anything else? I think sharing this with Hal would be good, so I'll leave it in your hands to head us to Heather.
Cool. Could we do that before Thanksgiving, just while it's fresh in my mind, or is that too soon? Okay.
No. I think I think Hal's on a roll and wants to move forward.
Okay.
So I think if you send out an email with a suggested date and time.
Okay. Sounds good. I haven't read through all of them yet, but the emails that came in today about making the biofeedback more interesting, and maybe this was suggested, but one idea is making it into like a video game at some point down the road. Have you ever played the game? This is going to sound ridiculous, like Splashy Fish? Do you know that one?
I do not. Okay.
In your free time, look up the app Splashy Fish. It's free. It's what you do, it's on your screen, and you press your screen as quickly as you can to get this fish to go in between these barriers in the ocean.
I can picture that.
Yeah, so kind of like a video game or like a Mario Kart where you have to jump up on the boxes and you have to press so hard to jump so high. I think that's a way long-term idea. I think it's a fun idea. I think it will engage people. It'd be a fun rehab.
Okay.
But down the road, maybe. There's no research behind that. You probably saw a couple years ago with electrical stimulation. They did it in a video game format where each time you had to jump over something, you had to swallow in order to jump, and they hooked it with electrical stimulation.
No, I never saw that. That's interesting.
Cool. It was in Florida at some swallowing clinic where it was with electrical stimulation. They had a bunch of news articles on it, and they showed how it worked, and it was meant for kids. But I could see how adults would find that fun. I would find that fun.
I would too.
So.
Yeah, please remember to share that when you talk to Hal.
Okay.
I've been resisting expanding the scope just so we can move material forward and not sideways.
Yeah, this would be a sideways movement.
But I still think it's good to have this on the table.
Okay. Sounds good.
Okay.
Yeah. With
Well,
the conference, yeah, I have no thoughts, I don't think, on the conference things.
Well, one of the things I'm going, by the way, thank you for sharing that with Betsy and getting her feedback.
Yeah,
I think this market research is oftentimes overlooked, and it leads to a lot of money being spent and nothing to show for it.
Mm-hmm.
So,
Yeah.
so I think this is really an important part of what we're doing.
Mm-hmm.
So, on the conference call coming up in 9 minutes, I am going to suggest that Laura take the lead for Las Vegas and you take the lead for GRS.
Okay.
Are you okay with that?
Yep, I'm good with that.
Okay. I'll talk more about what that means.
Okay.
But I wanted to make sure and I'll share with you 2 medical things going on with me that I guess I'm sharing with you. I'm curious about what you've seen in other patients, and I'm just curious. So I've been very fatigued for about 2.5 months, and my head and neck surgeon at Anderson, who is the person I work for, he said I may be aspirating silently in my sleep, and it's creating a situation where my body is continually fighting an infection.
Yeah. Have you had a fever, even like a low-grade fever?
No, I haven't, but I take medication that could suppress a fever.
Okay.
Is this something that you've seen in other patients?
I've seen patients that aspirate from their secretions in their sleep. Yeah, I mostly work with acute patients, and so that happens frequently. A lot of times they have them prophylactically on antibiotics to treat anything like that during their hospitalization, so you might not even know if they were going to get an infection from that. They're treating them for an infection that's not even there yet. For the high-risk patients is what I've seen.
Well, that's interesting. I didn't know people were on antibiotics prophylactically.
Yeah, I'm not sure if that's recommended, but I've seen that happen. I think when the risk is so great and their condition is so fragile that they're not worried about becoming antibiotic resistant, is that it's more important to prevent any infection from occurring.
And and I've kind of minimized it in my mind because of how dry, how my saliva glands are 90% shot. So anyway, that's one. And two, I think I've lost neck muscle, and and it's pulling on my shoulder and creating discomfort. So I'm about to start a series of visits at Anderson.
Okay.
Have you seen other people that have lost neck muscle?
I've seen, I guess, people that become more fibrotic 10 years or more after their radiation. And I could see how that could increase tension if it's just stiff tissues in there. I mean, I haven't seen significant muscle wasting or muscle degeneration necessarily, but I mean, as we age, we all have some muscle wasting that goes on, and I suppose if it's already compromised from the radiation, it could occur faster, more quickly. Yeah. But
okay. Well,
I would ask somebody with more experience for sure.
Well, I'm headed down that path, and I thought I would share it with you, not necessarily for free medical advice, but just to let you know what people you see may be going through.
Yeah. Well, thanks for sharing that.
Yep.
Yeah, I hope they can tell you some things that are helpful.
I hope so too.
Yeah.
Okay, let's end this call, and I'll see you in 2 minutes.
Sounds good.
Okay, thanks. Bye-bye.
Bye.